perché là siccome c'è la luce dietro come preferito.
Selamat siang, dokter sekalian. Kita berjumpa kembali di acara webinar pada siang hari ini, yang mana webinar kita pada siang hari ini akan mendatangkan seorang pembicara yang luar biasa, pembicara yang kita sudah kenal, yaitu ada Dr. Luca Piovano, seorang dokter bedah plastik dari Roma, Italia. Dan sedikit dari CV beliau, beliau sudah lulus dari The First University of Rome sejak tahun 1988 sebagai seorang dokter. Beliau juga memiliki beberapa keahlian di bidang hukum dan hiperbarik, dan juga beliau sangat aktif di dalam asosiasi, termasuk juga sering datang ke Indonesia untuk membagikan ilmu untuk kita semua. Dan hari ini beliau akan membawakan satu topik, yaitu tentang dermal filler, dengan judul Fillers LP Injection Modes for the Lower Middle Third of the Face. Ya, yang mana LP injection artinya adalah metode dari Luca Piovano. Karena itu kita akan mempunyai waktu 1 jam ke depan untuk acara seminar ini, dan nanti kita akan mempunyai sesi tanya jawab setelah presentasi dari Dr. Luca Piovano, dan di akhir sesi kita akan memilih 3 pertanyaan yang terbaik untuk diberikan hadiah khusus buat dokter sekalian. Oke, Dr. Luca Piovano, how are you?
Okay. You can hear me? Hi.
Halo, Dr. Luca.
Yeah. Christian, you can hear me? You see me?
Yes, we can hear you.
Okay. Good morning, everybody. Good morning, Indonesia. In Italy is early in the morning. Yeah. Share the screen. You can see?
Yes, we can.
Okay, let's start. Good morning, everybody. Good morning, Indonesia. I will introduce my experience today in the infiltration of filler in the lower third of the face. Is my technique that I have. No, sorry. I have some problem. Okay, here you are. So that is my disclosure. A lot of company I have a collaboration, but the presentation is based on personal opinion and experience that I have in the last 20 years and is designed to be educational and not commercial. In the last 10 years, I have treated almost 5,000 patients with filler, 20% men, 80% women. And I'm lucky because I travel a lot. I have a lot of experience outside of Italy. So the most patients come from Italy, but I have treated patients from Arabian, Albanian, Brazil, Indonesia, Swedish, Vietnamese. So every different ethnics, and that is my experience. It's global experience on filler for the face. But you can see that is the area that we treat in my country, and in my country I treated more and more the lower third of the face, the pre-jaw, mandibular line, the marionette lines, nasolabial fold is the most common area that we have to treat in Europe. So for this reason, I decided to write a book of filler infiltration in the lower third of the face, because my experience is well established on this area. But anyway, we go to Asian subcontinent, this big, huge continent. So in Asia, is a very heterogeneous group of patients. We go from East Asia, Indonesia, Japan, Malaysia, to in the Indian subcontinent and the Middle East. Middle East is completely different shape and purpose and treatment. So Asia is a huge area with a lot of difference. But anyway, the Asiatic main issue that I find in my patient outside of Europe is over the change of shape, occidentalization of the face. Look, this lady from Indonesia have a Binder syndrome. This is complementary to surgery and filler for the correction of premaxilla with surgery and fillers. And then we have a lot of treatment of nose redefinition, nose augmentation is another big chapter for Asiatic people. And finally, we move to the lower part of the face. Unfortunately, in your country, we don't have a lot of cases of aging of this area, but the most important correction is due to the congenital defect. Look, this lady. This lady have a deficit of mental tubercle, the bone. So a big cheekbone and lower part in the lower third. So the balancing, the contouring for this lady is working on augmentation of the lower third. And then fillering all over the face. This lady from Indonesia is treated in the forehead, in the malar area, nasolabial fold. And again, another problem that I can find in your country is the treatment of the tear throat and periorbital rejuvenation and forehead treatment and full face treatment of correction with filler. But if you want to make a standardization, Caucasian versus Asian is different. In our country, we have narrowing face, aging face, ptosis, malar hypertrophy, chin hypertrophy, beauty triangle, and jaw squared, white skin, and aging face. In your country, in Asia, more and more we are looking for wide face, malar hypertrophy, more bone and fat to emphasize, to make augmentation of the zygomatic arc. Chin hypertrophy, oval shape, dark skin, and baby face at all. And that is the East Asian beauty. It's different, but all these patients are looking for the V-shape redefinition, like European elongation of the chin and V-shape of the face. And that is from my country. That are the sister of my hospital where I work, one from Italy and one from Indonesia. So both are beauty at all, and that are. But the best situation, in my opinion, is the mixing, the hybrid result from Asia, Africa, Italy, and the best for this baby, the best look that is. Look. This lady from China and this guy is doctor from Italy, and the baby is very, very nice. Is a hybrid. So the difference from Asia, starting from structural facial anatomy, slow rate of aging, and seeking treatment at younger ages. And finally, the optimization of Asian features. That is Asian, skull, and Caucasian. The difference, the large, the widening, and the prominence of female, man, African, Asian, European. It's a little bit different. So ethnic criteria, it's impossible to understand and make evaluation of patient motivation and expectation without understanding the patient aesthetic ethnic characteristic. Anyway, the aging phase in Asiatic is slow rate. The dark skin is very elastic, you are lucky. In Italy, we have white skin that after 20 have a lot of thickness of flaccidity, and the dark skin is more elastic, more beauty, and only in older patients we can see a deflation and the sagging face. But today, the content of my presentation, I will treat the area issue. So at first, I do an overview of the district. The anesthesia, what is recommended for patient satisfaction, so the patient come back to your office because he have no pain. And finally, the implantation technique, how to maximize the aesthetic result is very, very important. So with low product amount to have a good aesthetic result. And finally, tips and tricks to avoid complication or a natural result. The goal is a gentle lift of facial feature, restoration of natural curved facial contouring. So the face is due to curve, right, and depression on the face. The right dermal filler is very important. In the market, we have too much dermal filler. I use more dermal filler, but we have a lot of different dermal filler with different viscosity, different properties, and so on. It's very important, in my opinion, the exact technique injection. And finally, the combination of treatment. The combination of treatment, not only filler, but filler plus botulinum toxin plus radiofrequency plus laser from is the threads working in good combination with filler is very, very important. Look, this lady come from Cuba. I treated some years ago, and the important in the lower third is the lifting action, not the volumization, but we are looking for a lifting action in total harmony for this lady. The filler combination, I believe in filler combination. I don't use only one filler, but I like to mix more filler for the face treatment. I have no interest in any product mentioned, no royalty in this product, but I prefer to use HA filler, PCL-based filler, calcium hydroxyl apatite filler, carboxymethylcellulose filler in different way. So we can see in this area the temporal volumization, the malar zygomatic area for a good volumization, good restoring of volume. All these fillers are good. But in the lower third, in the jawline redefinition, I believe that only PCL-based filler and calcium hydroxyl apatite filler are good because are not heavy. They give stimulation and lifting action of this line. And for the mouth enlargement, I use only HA-based filler, and in the ear high area, I use lipofilling. For me, it's mandatory to use only lipofilling. I don't use filler to evitate the main complication for this case. Topography and correction. Look, this lady is typical Italian middle-aged lady. She has apoptosis of the face, and we have to study why we have this. We have 3 points of adhesion ligaments: nasolabial fold ligaments, pre-jaw ligaments, and zygomatic ligaments, and this is stable point. All this area is moving, is a lot of expression, and is moving down with aging. And it became a U deformity, is the ptosis of the fat and the soft tissue fall down with aging. What we can do for this lady with filler? We can do facelift, surgical procedures, but we can do also filling of the pre-jowl, post-jowl, to have a camouflage and a right positioning of filler in this and tensioning of the jawline. And finally, that is our result is a lifting, gentle lifting action of the face. And then we can make volumization, distension of the malar area that lifts up the cheekbone area of the malar. But we don't look for distortion of the face like this lady, Topo Gigio effect, where the diameters, transversal diameters, bigonial diameters is too big in comparison with the lower. This is an unlucky lady. Anyway, the application of filler is in all tissue. We're starting to feel the dermis, the superficial fat pad, deep fat pad, and we can inject over the bone and the ligaments to have distension. The injection technique is this classical linear fanning bolus technique, pyramidal technique, depends from your hands, from the correction that you want, and the patient. If you are using cannula or you are using bolus. For instance, when I make infiltration in the bone, skeletal bone, to correct the congenital defect of the chin, the maxilla, premaxilla, malar, frontal bone, I use mostly needle because I go deeper with needle in the bone. I make injection, distension, and that's on. When I using cannula, the treatment cannula is more superficial, and the spread of HA filler and other filler is very fantastic because with only 2 access points, 1 and 2, I can cover all over the face. And that is my favorite cannula, soft fill cannula. So the difference from needle versus cannula, I use both. I use needle, is more precise. I can use less product to get my result. But on the contrary, I have high risk of chemosis, of intravascular injection, but I can also inject in multidirectional way, and the injection is painful. With cannula is less precise because the cannula is very long, and to fill the product is not so easy in some hands. And I have low risk of chemosis. I can make a good infiltration without painful, no pain. And if you want to get more, you can go to see this paper from Zurich, the pathway where you can use cannula in safe way. Mostly, that is my favorite access for the nasolabial fold infiltration with cannula 25 gauge and nasojugal fold, the same access. Or sometimes you can use cannula also in the lips for the lips augmentation, enlargement, beautification. This treatment is very easy, cannula 25 gauge, 27 gauge, and 1 access point. We cover all the lips to make enlargement of the lips. No ecchymosis, no painful, very easy. Other time I use needle, like in this case. This lady have already, she has already filler. This is the second step of filler. I have to make correction, balancing of lip. So for this case, I use needle because the needle is more precise. I can manage the product in the right way and in the lip and around the lip. Let's to show you some cases from European country. That is the doctor from Europe, from Italy, that have treated the nasolabial fold with PCL-based filler. And my application is here, 1 entry point in this point with needle or with cannula. With needle, if I work very superficial, I use cannula. Is mandatory to use cannula when I go more deeper in the deeper subcutaneous layer to evitate intravascular injection. I use 25 gauge cannula. And it is the infiltration over the bone, the blue one, and the light blue is more superficial. And finally, I make a crisscross in the other part. That is the lady. Before and after for the nasolabial fold. You can see I have not overcorrected the patient. I never make overcorrection. I do the filler mostly deep over the bone to make sustainment of all these area, fossa canina or fossa piriforme. That is my fillering area. And after I feel more superficial. This lady has a difficult labial fold, starting from nasolabial, but the problem is this is rhizoid muscle. This muscle make traction and make this kind of wrinkles. It's fold, very deep, difficult correction. For this correction, I use filler very strong, like PCL based filler, and that is the patient before and after treatment. Before and after treatment. The patient is very difficult, oily skin. And then we go down to the chin. Look, this lady, you have a little fat deposition and mental, but the real problem is low projection of the chin, and that is after infiltration, before and after, no surgery, only fillering of the chin tubercle. How do you can manage in easy way this infiltration? The infiltration of the chin is very easy. You can do 1, 2, 3, 4 bolus in this area, pyramidal. I touch the bone and I make infiltration of filler going away. And soon after, immediately, I go superficial with cannula in funny technique, more superficial. So the infiltration for the chin is in double layer, deep and superficial in a sandwich technique. And that is this lady from Arabia. Look, the chin before and after the correction. Also this lady. Look, this lady, big face from Poland, the correction in the chin, pre-jowl. Look, but I inject not only in the chin, but all the lower third of the face.
Alice non riesce ad aprire il Word della presentazione. Se apre il PowerPoint non apre il Word.
Deve aprire da parte?
Non riesce.
Devi spegnere il tuo computer e avviarlo che si è bloccato.
Dice il doc.
And that is the correction of the lower third of the face. You can see the harmonization, the contouring, because in this face it's very difficult. This big, huge face, we don't do the amount of filler, but we have to do only the correction of the lower third. And this lady is one of my favorite because she comes from Cuba. The skin, dark skin, is very elastic, and for the correction of the U deformity, just to feel the pre-jowl, post-jowl, to have a good lifting action and refreshing contouring of the face. Usually, my entry point in the post-jowl is high, is pre-auricular, and that is the infiltration, and post-jowl is a funny technique with needle. But I have a lot of video about that. I can share with you if you have time. That is the patient before and after the pre-jowl redefinition line. Riuscita? Look this video. Sto facendo una cosa. Alice, dimmi. Comunque io fra un quarto d'ora ho finito. Fra un quarto d'ora ho finito, Alice. Sto parlando. Allora tu trascina, vai può fare. Io ho detto vieni qui, c'ho tutti i schermi, stupida, sto a casa. So that is the jowl. In this patient, I treated with radiasis, calcium hydroxylapatite. It's a very good product, huge product for the correction of the jawline. This video is old. This technique I do almost 10 years ago. Now I a little bit changed. The access point is not here, but I prefer to make hockey stick infiltration. And I will share with you my new video, new technique for this kind of correction. Mi dispiace, però io posso fare, io ho detto vieni qua, c'ho tutti i schermi, se non funziona uno prendi tre computer. Ma quando uno non capisce, fa questa la madre non capisce niente dei video. Perché lei fa il PowerPoint, così, lei però vuole leggere.
Me l'ha detto, solamente se è francese, che c'ha più...
E allora mette l'iPad accanto e mette l'iPad accanto. Poi mette l'iPad con la scritta. It's very important the massage after treatment, early after treatment, because the distribution of microsphere is well done with this treatment. After that, after 1 day, 2 days, the microsphere make, that is the patient before, after 3 months, 3 cc of radius, calcium hydroxylapatite. You can see the jawline redefinition. Time is running, and that is another patient with the jawline. Unfortunately, you don't have a lot of this case in your country. That is the hockey stick infiltration. In Italy, we have a lot of this kind of correction on the lower third. So the jawline injection is one of my goals for this treatment. Needle here, because the skin is very attached to the muscle. And the pre-jowl hockey stick infiltration with cannula. The cannula, usually I use 25, 22 gauge cannula. In this patient, I treated with PCL-based filler. Elance is another gallmaster filler for this kind of correction, because it's not too heavy, it's very elastic, make a production of collagen and make restoring of the skin elasticity at all. And again, some patient about that. This patient, middle age, pre-jowl, post-jowl, nasolabial fold, before and after. That is the V-shape restoration, before and after. Before and after the V-shape restoration with filler, PCL-based filler. But look at this lady. This lady is 48 years old, and I follow the patient for some years. And that is before the planning, after treatment, and 1 year later, that is the improvement. But 2 years later, it's better. He changed the color of the hair, but the stabilization, the contouring is better and better. And 3 years later, that is my patient with this kind of filler, long-lasting filler. Very good. Before, aging phase, after filler, lifting action, restoring, contouring, and rejuvenation. And now we move to another problem. This patient comes from Surabaya. This patient I treated in the nose, but she asked for me for the nose correction. But really the problem is a congenital defect of the lower third. of the mandibular line and the chin. So I planned for this lady not only the nose correction, but the chin elongation. And the chin elongation give me a good shape result. Look, this lady from Surabaya. Round face before, view shape of the face, just feeling in good way the lower part of the face. And look, the patient, she so nice, so happy after the treatment with this new look. And it is an immediate post. And the filler that I used, PCL, is long lasting, so I never see her, but I imagine that the result will stay for more years in this patient. Now I want to share with you another video of a jawline before to move. Wait, I want to share this. You can see the video? Christian? Yeah.
Yes, we can.
Yes, you can see the video.
Yes. So pre-jowl, post-jowl in autistic way. And that is another patient in my country, jawline redefinition. I do this video just 1 week ago. This lady, she has moderate sagging. We are marking the right correction with filler to the jawline. Pre-jowl, post-jowl in autistic way, and then we go to mark the marriage lines and not matter fold please. It's important to correct this one to remove correction for the indication of the lower third of the face. The entry point of the cannula, my cannula, it will be 3 points. I will cover all the area. And let's start. The first approach is the anesthesia. Anesthesia, light the pain with epinephrine in the right plane, in a focus, right manner, to make a high dissection of the skin from the subcutaneous tissue, and to facilitate the autistic infiltration very high to make elongation of this area. Using the sterile cannula 22 gauge. Very precise cannula for this kind of correction. Stiff cannula that can I manage my correction in the layer. That is my evolution. Stiff cannula is more predictable to have good infiltration. The cannula go through the tissue very easily. It's important to stay superficial over the fascia, muscular fascia. Don't feel the muscle, don't feel the bone, but very superficial. Retrograde injection in forward injection 2. With this kind of cannula, long cannula, 70 millimeters, I can cover all the area in good way. Total, I injected 0.4 ml of filler for this kind of correction. The filler is PCL based. È riuscita? No. Devi venire qua e facciamo subito. montato, chiamala. Questo qua e c'è due computer.
Finally, I approached the natural level fold correction. The central point will be medial to the natural level fold to indicate the vascular pedicle. I use the 25 gauge cannula usually, and I inject the first infiltration into the premaxilla area. Nearby the nasal spina, I give a good full support to the nasal level fold, and one press very deep of filler, CL based filler. And then step by step, in a funny technique, I move more superficial, and the last infiltration will be in the angle of the nose. Right, just right now, I completed the infiltration of nasal lateral fold. So, finally, to improve the lower third, the tuning of the face is very important. Tuning of the post-jaw, higher neck, and nasal to have a complete correction of the lower third of the face. And a good shaping and stable shaping. Finally, a sheeting mask is very important to apply with eyes for a few minutes to reduce the redness of our treatment. After a few minutes, we remove the mask and we can massage and through a uniform distribution of the particle, the atmosphere of the CL base. Thank you all for your attention.
Okay, you stop share, and now I go back to the presentation. Share the screen. PowerPoint. Okay. Christian, and go on the neck. More, the lower third. We have another problem, the neck wrinkles. What I do for the neck, before that is venereal collar deformity. We have a lot of this problem in our country. I do hyaluronic acid plus botulinum toxin, because you can see the muscle, the platysma muscle is very active muscle. I need to release this muscle with a low dose of botulinum toxin. So usually I do marking the symmetry of the neck to have the symmetric infiltration right and left. And then I apply a combination of hyaluronic acid-free HA plus botulinum toxin and amino acid to give stimulation and more elasticity of the skin. So that is my techniques that I have standardized in the last 3 years for this kind of correction. In one shot, I do the complete correction for the neck. And for 2-3 months, the correction is stable. It's not long lasting. I have to repeat this treatment like a biostimulation. I go a little fast because the time is running, and that is the microbotox injection, and that is the application of botulinum toxin with 32 gauge needle, very short, 3 millimeters, 4 millimeters needle, just in the subdermal plane with hyaluronic acid and amino acid in this part of the face. And this kind of correction is over all the neck, not only in the jowl, subjowl area, but in all the neck. You can see I cover all the neck, especially in the venereal collar. Then later on, a little massage. This pompous-like stay only for 1 hour, disappear because it's not cross-linked hyaluronic acid. It's free HA and is a distribution by itself in the skin. What is the advantage of microbotox? That is the botox is not inside the muscle, but is over the superficial layer from the dermis to the superficial layer. So the awakening of the muscle is very superficial, it's partial paralysis. Awakening is no more muscle paralysis total, like botulinum toxin. And also I have the activation of gland skin extension, and the skin improve with this kind of combination of treatment. Look, this lady, before neck, yellow tox correction, after correction. Before, look the angle after. Improve also the cervical-mental angle with this kind of treatment. The wrinkle, the texture, the cervical-mental angle improve with this kind of treatment. And that is the patient before the treatment, immediately after. And that is another patient, micropapillary infiltration. And that is before and after. Before and after. Look, the flaccidity of the skin, the hypotone of the muscle, and soon after the improving of the neck. And that's all. And another lady with venereal collar before and after neck infiltration. Finally, we speak almostly of filler, but in your country you have another problem, the hypertrophy of masseter muscle. So for this treatment, I believe that the botulinum toxin is the gold standard for the correction. To make a good shaping triangulation of the face, the treatment with botulinum toxin, at least 3 injections, 5 units per point, in total 50 units. That is, we reduce the thickness of the muscle. And that is what we can obtain only with botulinum toxin correction. You can see the square face, hypertrophy of masseter, and after treatment. Right, the gold standard, the best solution is the combination botulinum toxin at first and filler in the chin to make elongation. So the combination of botulinum toxin in 2 steps, absolute botulinum toxin and filler for contouring is the best solution for this kind of correction. 5 units per side because it's very strong muscle for this lady. You can see in these and these cases. Also, we can treat in asymmetry. This lady 45 units right side and left side 35 units per side. So different because we have an asymmetry, and that is our correction. And view shape, occidentalization phase for this kind of oval shaped face. Another one, 25 units and plus 25 units per side for this lady. So in this patient, we do in 2 sections. 1 section after 3 months, 3 weeks, second section to have the best result for this kind of correction. Finally, I will conclude for the presentation of my last book, Injection Mold Filler. You can find all these things that we see today are published in this book. It's a video book, there's a lot of video, and the OEO Firenze is a good company, Italian company, editor based on Florence, OEO Florence. .com is the company that is editor for this book, and that is my connection. Stay tuned, don't hesitate to contact me for any question. For some cases I will be able to answer to you as soon as I can. So I see some question. Christian, I don't hear you.
Yeah,
Hi,
okay.
Christian.
Thank you, Dr. Luca. You can hear me?
Yeah.
Yeah, thank you. Nice presentation. I think this is very important for us to know how to correct the lower face because it's very difficult sometimes. And there's some question in our question and answer bar. For our participant, you also can send your question to this bar. You can write it and I will read and Dr. Luca will answer the question.
Yeah.
And maybe we can start with the first question, Doctor.
Yeah.
I think you have answered, but maybe you can explain it by words. Hi, Doctor. Are there any tricks how to prevent migration of the filler, especially on the nose? Thank you.
Can you repeat, please? Because I'm after filler. Displacement of filler. Yes, understand. So
how to prevent the migration.
For the nose, I have my personal standardization. At first, you have to do a good anesthesia. With anesthesia with epinephrine. Epinephrine gives you a vasoconstriction, the vessel. The patient have no pain and no bleeding, no intravascular injection because you do a good vasoconstriction of the nose. First. Second, I use some kind of filler. I write before like calcium hydroxylapatite, radies, or I use PCL based filler, is Elance. This kind of filler works due to the microsphere infiltration in the tissue, and this kind of microsphere give you a good reaction, fibrotic reaction, at first inflammation, and is impossible to move the microsphere because the microsphere is very attached where you feel. So if you use a lot amount of hyaluronic, I see a lot of cases of dislocation, especially in the lateral part, in the nesium, the upper part, there is an enlargement. So it's very important the kind of filler that you are using, Christian.
Okay, so we can consider with the material, right?
Yeah.
And the second question, Doctor, how to minimize ecchymosis if we use needle for injection?
Yes, I also in this case, I answered before, I do a lot of highs pack before infiltration. I put highs in the face, pack for 10 minutes. So vasoconstriction. And then I use, in some cases, anesthesia with epinephrine, topical or infiltration. So I have vasoconstriction. And last but not the least is the area that you are feeling. If you feel in this area very deep, there is the angular artery, the facial artery. So I try to make infiltration with cannula. So I avoid needle, obviously.
Okay, that's clear. And then we also have a very nice question. What is the best modality for turkey neck? Can we do microtox?
Yes, I do microtox. And in the neck, I do the classical Botox for the platysma band. The platysma band, absolute Botox only, because it's very strong. And then I do micro Botox all over the face in the same section or after, soon after.
What do you think with KH, calcium hydroxyapatite for the neck?
I tried 10 years ago, and that is the problem, that the product is not stable, because you mix 5 ml of liquid solution with 1 syringe of radiesse, and the new solution is not stable. So you have to be aware, because you can have the risk that in some point you inject the radiesse, in some point you inject only water. So you can have irregular result, you can have cluster. For this reason, I don't use, but it's very good solution. It's new solution, but it's not stable. It's not, yes.
Okay, so very clear. And we still have many questions. And the next question is, are there any advice to minimize the overcorrection with the HA filler at any site?
HA filler any side?
Overcorrection.
Yeah, overcorrection. You have to make planning before. I prefer to treat again the patient 2 times to have a good correction. Anyway, you can have hyaluronidase to reduce the overcorrection all the time. If you use radiesse or PCL based filler, let's say you don't have hyaluronidase, you can have collagenase, you can have corticosteroid to reduce a little bit. That is.
I think using HA may be easier to make an overcorrection, right? Because we have hyaluronidase. But yeah, what do you think if we do overcorrection with PCL?
PCL, I do washing of the area with anesthesia. I do corticosteroid. Cortico. I do collagenase to reduce the collagen. That is.
Injection?
Over injection. Over.
Okay. So we will go to the next question. Hey, doctor. How the trick to make the nose filler without complication and make perfect nose for Asiatic?
Yes, very important. You have to know, never overcorrect. I know that the Asiatic nose is lower. You need you need to do more treatment. Maximum 1 ml of filler each time. And then you have to wait 3 months. After 3 months, another syringe. But never try to get your result immediately, because the complication rate is very high. If you inject 2-3 syringes in one step, you can have a lot of complication. Also the Botox, if you inject too much Botox in the forehead, you can have ptosis because you overcorrect. You inject the right infiltration, right amount, and then you wait, and that is the solution in my experience.
Okay, and we still have a good question. How many cc maximum injection for the patient in 1 day? And it is possible to make injection for whole face in 1 day, and what is the risk?
No, you can inject. The problem is that if you use product like calcium hydroxyapatite or LNC, the product gives inflammation. If you inject more than 3-4 ml of product, you have big inflammation, big edema. If you inject hyaluronic acid, you can inject 6-7 injections per day, but no more. I don't suggest more. So Radies 3 syringe, Lancet 3 syringe per day, and hyaluronic also 5 syringe you can inject.
So maximum 5 syringes for you?
Yes, for section, no more.
Why?
Because you can have some problem of dislocation, something like that. So you have to have time that the filler is good in interaction with the tissue. If you inject too much, I prefer to see again the patient.
What do you think if we inject in many areas, like in temple, in the chin, in the nose?
Many
So
areas
how many cc's
in many areas you can, because you can inject in the chin, in the lower part, to have a lifting effect in the temporal. You can inject more. You can inject 6, 7, 8 syringe.
Oh.
Like the De Mayo. Look, the Brazilian doctor, De Mayo, you know, he injected 10 to 15 syringe in one time. But at first it's more expensive, and then you have a little bit more risk of complication.
Okay. So we can go to the next question. Can you explain how to mark the entry point for post-jaw injection, especially to avoid facial artery? Thank you.
Very good. Okay, the facial artery is in the middle. So I stay forward, before and back the medial artery. I inject usually in the mandible angle, or more and more in the pretragus area. And then I inject here anterior to the facial artery. You can touch the facial artery, you can feel the pulsation, you go forward.
Okay. And the next question is, oh, sorry. The question is
same.
not about the appraisal, yeah, and you have explained it. And we still have another question from the panelists actually. She want to ask you if you have another combination for microbotox besides the normal saline.
Yes, I do. I use microbotox plus hyaluronic acid, Hyalupro. I don't know you have in Indonesia. Hyalupro is a blend of amino acid that give me restoration of skin. It's the biostimulation, and free HA, very low kilodalton, 200 kilodalton. So the hyaluronic acid give you a stretching effect on the skin, hydration, and make vehicle for the Botox. That is my last my last techniques. Yes, Hyalutox, Hyalupro plus microbotox.
Okay, that's great. Okay, thank you so much, Dr. Luca.
Thank you.
I think we have no more time because we have talked for 1 hour.
Yeah.
So we will end this session. Thank you for the presentation. Thank you for the knowledge. And I hope that all the knowledge can be practiced for the doctor in Indonesia. Thank you so much.
Thank you, Christian. Thank you, Indonesia. Bye-bye. See you.
See you. Oke dokter, untuk peserta, terima kasih atas perhatiannya. Kita sudah 1 jam mendengarkan satu teknik yang baru dari Dr. Luca Piovano. Dan kita juga mempunyai 3 buah hadiah untuk penanya yang terbaik. Yang pertama kita akan berikan untuk penanya yang pertama, yaitu Dr. Mary Lindawati, ya, akan mendapatkan voucher SWAM. Dan juga penanya berikutnya yang juga penanya yang terbaik, yaitu penanya tentang Turkey Next. Tadi ada dokter sebentar. Dokter siapa tadi? Oke, dan penanya yang ketiga dulu yang terbaik adalah ada dokter, oh ini, Dokter Sylvia Puspasari dengan pertanyaan, apakah modality yang terbaik untuk terkinek? Karena ini adalah juga yang sangat sering kita temukan di klinik. Akan mendapatkan voucher diskon untuk acara SWAM. Dan juga yang kemudian adalah Dokter Firdi Liwang, yang juga banyak sekali kita hadapi di klinik dengan pertanyaan, apakah ada trik untuk membuat nose filler tanpa komplikasi? Baik, 3 penanya ini akan mendapatkan hadiah dari SWAM Webinar, yaitu berupa voucher, C-SWAM, I-SWAM, dan W-SWAM. Dan kita akan akhiri sesi kita pada siang hari ini. Terima kasih atas perhatian dokter sekalian. Kita akan berjumpa kembali di webinar yang selanjutnya. Terima kasih, selamat siang, dan selamat beraktivitas.